Welcome to the First Nation Health Manager's home here in unceded Algonquin Territory in Ottawa. We're really excited to have you all join us via this technology platform. Thank you for allowing us into your territories via technology. So thank you very much, Bienvenue.
And I remember talking to him the next morning after all this had happened. And there was a line there that really stuck with me. He said, you know, Alika, at the end of the day, it doesn't matter what I've accomplished in my life. When I put on that hospital gown, I'm just another Indian. And that really stuck with me and led to a lot of different conversations about racism and discrimination and bias, and how, because of my role as a physician, he was able to navigate some of those systems. And so what Safe Space does is it's a way to share anonymously your story, and for it to be captured and then combined with other stories so we can discover patterns. And those patterns are then validated through a series of steps and connections within the health system. And once we have some confidence in the repeatability and reliability of these stories, we then share them with the health system and with patients so we can all make better decisions.
I know resources will be there. Economic recovery will happen. So for right now, we just have to worry about the aftermath and take care of each other, take care of our country, take care of our province, take care of our nations. And then at the end of the tunnel, we'll be back to where we were. But then this should be a wake-up call to everyone across Canada, across the world. I know this is just the tip of the iceberg of being prepared.
I'm very proud of our staff. We did, during that period of time, 26,600 and such wellness checks. So our community felt supported. They were called constantly to ensure just every single day someone out there was getting a call from Wabano saying, how are you doing? What do you need? And what is it that we can do to make your life better?
With everything that has been thrown at us, we've built a strong security system within the community. All the checkpoints were shut down. The nursing staff, the medical staff of Pastrac was beefed up. We had the military on some and still do where needed as needed. I believe we were one of the first in Canada to call in the Canadian military, and they responded very quickly and effectively, and very thankful for that.
It's important that we ring the alarm bell about what's happening in Toronto. There's been thousands of cases of Indigenous people getting COVID-19. And right now, to serve a population of about 70,000 people, that's about how many First Nations, Métis, and Inuit are in Toronto, there are 2 part-time clinics. And they are doing incredible work out of Anishinaabe Health and the Aduje Clinic, but they're getting so tired. And there's a wonderful network of urban Indigenous organizations that are just working around the clock to help people, keep people safe, and ensure they have access to the vaccine.
We had a lot of thanks and gratitude from the communities for coming and for providing vaccine, but the thanks and gratitude really went both ways. And we had team members who used words like this was life-changing for them, that this was a highlight of their career to be able to go into these communities and contribute in a positive and preventative fashion. This was an opportunity to interact with the communities in a completely different way, in a positive way. We're able to build some really strong relationships. And really, we are thankful and grateful, and we feel privileged to have been invited into the communities to participate in something so monumental.
To date, and I'm really excited to share this number actually. So to date, VIO volunteers has been able to give just over 1.6 million masks, 9,450 face shields, 7,662 liters of hand sanitizer to 174 Indigenous communities and 32 organizations in 7 provinces. Thank you very much to all of our supporters, to FNHMA, to Nation Talk for having us on here and helping us spread the word.
And I think that this is one of the first times that I've seen a truly a strong attempt at an equitable rollout for vaccine, for healthcare services, for First Nations, Inuit, and Métis people living on reserve. My goal is really to see as many of our people continue to thrive through this. And I know that there is so much more than just social distancing. You know, it has been really hard for us. It's been a really hard year and a half, and we're going to get through it, but we've just got to keep working together to get there. So I'm very happy to be here today. Thank you very much.
I really want to thank all the healthcare workers, and not just in Ottawa. I mean, I've seen it all across this province and country, physicians, nurses, housekeepers. We're very fortunate to have people rally like they rally. And they have done a remarkable job. But I think part of as we come out of this is people truly need a break. And so part of what we're looking to do in the summer is get people away, get them into some holidays, get them back into a sustainable work-life balance, and try and resume some level of normalcy as we head into the fall.
It was important from the start to look at the program, look at a program that included Dehcho people as participants, as staff, to have Indigenous people working with us, to be on the land, and of course to deliver a program that was safe and that adhered to COVID protocols.
We did this in -30 for a week, so we had participants truly learning to survive on the land. That was a part of it. That was a huge part of it, of what the program was. You know, it really is survival, working together. It was not fun being up every hour to put wood into that wood stove, but you had to, and everyone looked after each other. And again, that's what these land-based programs do. They put the responsibility on individuals to have to survive and look out for each other. And you're going to grow from that, I think, regardless. So
when you wear a mask, you're protecting yourself and others. When you wash your hands, you're protecting yourself and others. When you keep a moose length, a fishing rod length away, a deer length, you are protecting yourself and others. So let's stick to the scientific data that keeps us safe. Get your flu vaccination.
Yes, and I think it's a moose length, not a deer length. Unless you have humongous deer where you live. Our deer here are really small.
That's true. That's true. And don't get too close to the moose either was another. Keep safe.
I just want to say thank you again, Marion, for allowing us and inviting us to come on live with what's happening in Pegasus over.
Thank you, Marian. It's always a pleasure. I'm so excited to be here today, and I want to thank you again for inviting me to be a part of the town hall.
Well, thank you so much, Marian. As always, it is such a real pleasure to be with you and the whole town hall team, and to have this opportunity to join you all on behalf of Indigenous Services Canada to share some COVID-related statistics for First Nations on reserve for the town hall today.
Hi, thank you so much for having me, Marianne. I'm so happy to be here today.
Thank you for joining us, and hi.
Until next week, stay safe, stay healthy, hi.